Welcome, everyone. My name is Cynthia Arofo. I'm a nurse, a founder, a Women Who Empower Award winner for 2022, and a very proud double husky. From entering Northeastern first as an undergraduate Northeastern University nursing student to now working as a nurse scientist, I feel particularly indebted to this university who helped me carve out a global path within the nursing discipline. And as an innovator, creating solutions to improve healthcare access and outcomes, I am truly honored to help introduce powerful dialogue on life sciences' role in advancing public health globally. With advances in technology as a massive driver, the pharmaceutical industry is positioned now more than ever to transform patients' lives across the globe. And this includes Latin America, where expanded access to digital health creates opportunities for life sciences companies to innovate and improve patient outcomes and public health overall. Our speaker today is a triple threat with expertise in the global pharmaceutical industry, a deep appreciation for the power of innovation, and a passion for advancing science to benefit patients, and this is well appreciated as the nurse in me. We are honored to be joined by Christopher Viehbacher, President, CEO, and board member of Biogen and Northeastern University trustee. Mr. Viehbacher has extensive international experience in both large pharmaceutical companies and entrepreneurial biotech companies. He joined Biogen in 2022 after serving as the global CEO of Sanofi, preceded by 20 years at GlaxoSmithKline. In addition to being a Northeastern trustee, he's a member of the Board of Fellows of Stanford Medical School and a member of the MIT President CEO Advisory Board. He well understands the challenges and opportunities facing the life sciences industry today in addressing healthcare on a global scale, and we are pleased to have him join us to share his insights, especially in much warmer weather than Boston. Now, I promised him a few moments ago that I was gonna pump up the energy, so please join me in welcoming Mr. Chris Viehbacher.
Thank you, Cynthia. We just heard the last presentation, you have to be an artist before a scientist. Yesterday I saw a pretty cool video of some protofibrils on an electron microscope. But thought about bringing them, but still probably wouldn't have competed with those underwater sculptures, I have to say. So let's just switch gears to health. I'd like to describe this theme as health is wealth, and wealth is health. And if you think about health, unfortunately, people don't really think much about health until they really get sick. And for all that we can have in the world, if you don't have good health, you don't really have much. But unfortunately, we find good health mostly where there is wealth. And so that's something I'd like to talk about. Let me first introduce Biogen. So Biogen is an iconic company in Kendall Square. We are the oldest independent biotech company. We are also the very first biotech company in Kendall Square. We were founded 45 years ago by two Nobel Prize winners, one from MIT and one from Harvard. And Biogen has had a true pioneering history. We're one of the first companies to bring a treatment for multiple sclerosis and have really been focused on that over 45 years. Just last year, we launched 4 new medicines, all first in class, all first ever disease modifying agents. One for postpartum depression, another for a rare genetic mutation of ALS, another for Alzheimer's, and a fourth then for Friedreich's ataxia. I was in Japan last week talking to some physicians who were using the medicine that we introduced in 2017 for spinal muscular atrophy. This is for infants who normally died at the age of 2. And she was so excited that her patients now are approaching high school, all thanks to this first-in-class medicine for SMA. So it's interesting because every medicine that we launch, we have to actually go out and educate physicians about. Friedreich's ataxia, for instance, affects less than 5,000 people in the world. The drug Qalsody, as an example, was developed originally by Bob Brown, who is now at UMass Boston, but was done when he was at Massachusetts General Hospital, discovered this gene. 30 years later, we managed to come up with a medicine to treat this rare genetic mutation. And there are less than 300 patients in the US. But this medicine will get people out of wheelchairs, and this is normally a disease that kills people. So I can tell you that it might not be as exciting as art, but there is nothing like the job satisfaction that you get out of healthcare and really seeing the difference that can make in patients' lives. So we're talking about Latin America. What's the status of healthcare in Latin America? Well, it's improving, but it's still quite challenging. The average age expectancy, life expectancy in Latin America from birth is about 75 years. Now that's added about 4 years since the year 2000, but it's still less than the global average of about 80. Healthcare spending is about 6.9% of GDP, and that's versus an OECD average of 8.4%, and significantly less than about the 18% of GDP that we spend in the United States. Access and affordability are a major issue. It's about 24% of out-of-pocket costs for patients in Latin America. That compares to about 14% in Europe and 10% in the US. If you look at metrics around maternal and child health, they're significantly behind the OECD as well. And one of the things that we are seeing around the world is that for years, most diseases were caused by so-called communicable diseases, bacterial and viral diseases. What we're seeing now is chronic diseases taking the fore, largely due to problems of obesity and nutrition. So what can we do in global health? And I'm grateful for the opportunity to talk about it because this has been a passion of mine since I started in this industry 35 years ago. I joined the German affiliate of a company called Wellcome the year we launched the very first medicine for HIV, a medicine called AZT. And that was the pandemic at the time. And HIV probably has done more to transform healthcare systems around the world than almost anything else, up until at least COVID. And indeed, actually, when you look at what has caused trends in healthcare, you can often trace these back to pandemics. There's an organization for Latin America called the Pan American Health Organization, PAHO, for example, that really got its start because of a yellow fever epidemic in the mines of Latin America. And when it came to HIV, this was actually a disease that disproportionately affected people outside of OECD countries. And there was no real solution for this. And yet we had these medicines that could actually not only treat people, but one of the most important things was to block maternal fetal transmission. So pregnant mothers, if they took AZT, for example, in the 4 weeks up to pregnancy, could avoid having the infant come into this world HIV infected. And I was running by then the French affiliate, and there was a gentleman named Bernard Kouchner, who was the Minister of Health at the time, became a very good friend. And Bernard, in addition to being Minister of Health in France, is one of the founders of Médecins Sans Frontières. And so he got me very interested in how do we actually help people beyond the rich countries. And you discover a few things along the way. One is, obviously, we have treatments, but you actually have to help build healthcare systems. And so that's what we did. We came up with some novel pricing mechanisms. We actually got an agreement that is written nowhere, but there was a tacit agreement that the wealthy countries would allow us to charge more for these HIV medicines and recoup the investment in research and development, but sell the medicines in the developing countries at a no-cost, no-profit basis. And that had a big impact even in Latin America. Brazil had a major crisis of HIV. But in addition to that, we realized that we had to actually invest in education and building up of healthcare systems. And that's where an organization, for instance, like PAHO is extremely important. How do we train more physicians? How do we train more nurses? How do we get education out to patients? How do you deal with the taboos that are often related to such disease? This is a sexually transmitted disease, and that made it even more difficult to treat. But it was a model for how you could do things. And a lot of what came out of HIV really built the healthcare systems that made them more resilient. There's another example, which is vaccines. Because it's not just healthcare. The healthcare can actually drive economic development. So if you take childhood vaccines, they can have a big impact on infant mortality. And one of the things that you find is that economic development is often related to family size. And where you have high infant mortality, you have large families because you don't know which children are going to survive. But when you have large families, the family spends all its time just trying to figure out, how do I raise these children? How do I feed these children? And when you actually reduce infant mortality through vaccines, you find that you can reduce family size. And now the families have time to actually go and find work and actually develop more wealth. And there's a fascinating economist, Swedish economist, who's unfortunately passed away now, but I can highly recommend his presentations that are still on YouTube. It's a gentleman named Hans Rosling, who has these fascinating dynamic slides that take you through hundreds of years of data to actually show you how improvements in healthcare can actually have a massive economic impact. Now, some things don't still work. I was the chair of the investment committee for R&D of the Global COVAX initiative when COVID came along. One of the things that we found there was there is no global solidarity when a pandemic actually hits. And one of the problems that we had was trying to source vaccines during the COVID time, when all of the wealthy countries were the ones who were making the vaccines, and all of the wealthy countries had stopped all ability to export those vaccines. And so we found there were have countries and have not countries. And so there is now an effort to try to move some of the manufacturing out of the wealthier countries and into more developing world countries, so that we actually have the healthcare infrastructure in more countries. And if you take a country like Brazil as an example, it actually has a vibrant vaccine industry. And so we can actually make sure that there are the tech transfers to ensure that if there is another pandemic, there'll be a more distributed base of vaccine manufacturing. In terms of how do we address some of those issues in Latin America, there are a number of things. I mean, medical education and international exchanges are probably the number one thing. And the fact that we have universities that bring in some of the top talent from around the world is so important in building the healthcare talent in countries. An organization like PAHO, which is interestingly enough actually based in Washington, does an awful lot to create education programs around infectious disease, around mental health, around sexually transmitted diseases. One of the problems is access. So there are some government programs. They will cover childhood vaccines. They can cover rare disease medicines, for example. But it's still the case where a lot of people actually have to defer healthcare in Latin America just because they simply can't afford it, and there isn't enough of it to actually access. Primary care is a real problem, actually, not just in Latin America, but even in North America. It's so great to see Cynthia as a nurse, because we are actually missing so many nurses. We're missing so many physicians, even here in the United States. And primary care is one of the most important of healthcare systems. That's where you can get a lot of the basic healthcare that can avoid some of the chronic diseases that really drive so much mortality and so much cost. Clinical trials are now done globally. Clinical trials for new drugs are extremely important because that gives an opportunity for physicians and hospitals to experience the latest in science. And it also allows us, as pharmaceutical companies, to have the clinical trials representing the global populations we wish to treat. And so we don't want to just do clinical trials in the United States, because even healthcare practices are different country to country. And so we do an awful lot of clinical trials all throughout Latin America, as an example. And the clinical trials actually fund a lot of the indirect costs that are important to the maintenance of hospitals and other health organizations. There have been global buying groups set up. So there's an organization called Gavi, as an example, that helps countries to buy vaccines so that it's not just a smaller country or economy like Uruguay doesn't have to go negotiate with large pharmaceutical companies. They do that collectively. There's another one was the Global Fund was instituted for medicines for HIV, tuberculosis, and malaria. I am a little concerned about what's going on. The United States, as you know, has decided to withdraw from the WHO. Those sorts of organizations are extremely important in terms of monitoring what's going on in disease. If there is another pandemic coming, that is how all countries are going to be aware of it. One of the things that we have seen is strong medical regulatory development. Every country has to approve a new medicine. So if a medicine's approved by the FDA, it is not approved in Colombia. And we have actually seen the emergence of strong regulatory agencies throughout Latin America. But one of the things I think that is quite interesting, and I'll maybe stop at this point, I think when we start looking at the shortages, this is where new digital technologies and AI can actually play a role. So I saw recently a presentation at Stanford where ChatGPT 1 was able to score a pass rate on national medical exams at the rate of about 32%. The most recent ChatGPT has a 92% pass rate. The human pass rate is about 87%. Now, ChatGPT is not going to replace physicians, but it will certainly enable healthcare professionals. And I think in terms of the shortages of healthcare, the ability to have virtual healthcare, I think actually digital technologies are where countries, particularly in Latin America, can really tap into these and improve both the access and affordability of healthcare.